I'm going to tell you now what's involved in knee replacement surgery. There are different types of knee replacement surgery, but if I take, for example, the standard knee replacement, that's where you're resurfacing all areas of the knee joint surface, and that's done typically for osteoarthritis and can also be done for rheumatoid arthritis. In that procedure, which takes about an hour and a quarter or thereabouts, it's important to correct the alignment of the leg, get the balance of the tissues correct, and promote good recovery. A combination of things are needed for that to happen. The preoperative discussion will talk about the type of knee replacement that you might be considered for, the types of anaesthetic, and there is also a discussion about potential complications, and those include infection, bleeding, thrombosis, and then a list of much rarer complications which are mentioned but usually don't have a bearing on your outcome. We do preventative measures to stop you getting an infection or a blood clot, so-called thrombosis in your leg, and that will promote good healing. The surgery is reliably good in terms of recovery. You're typically in hospital for about 2 nights or sometimes less. For a partial knee replacement operation, you'd be home the day after the operation. You then have outpatient physiotherapy, which is useful in recovering muscle strength, flexibility, and general day-to-day functioning. The recovery is measured in 3 to 4 months, realistically. It's rather quicker for a partial knee replacement, but for a full knee replacement, it is a longer recovery than, say, if you were to have your hip replaced. But there is a steady progression over time, and I would see you at around about 6 weeks after surgery to check the wound has healed, the swelling is diminishing, and the general strength and recovery is good. After that, then it's a little bit more physiotherapy, weaning off all the walking aids and reducing your painkiller reliance. Normally by about 3 to 4 months, you've had a good recovery of function, and from that point of view, I can return you to your GP. If you require knee surgery and you're suitable for a partial knee replacement, that's normally because you've got arthritis in one part of your knee causing most of your symptoms. So for example, on the inner side of your knee, if you had pain mainly there, then a partial knee replacement on the inner side of your knee might be sufficient to get you out of trouble. It will cover the majority of your needs in terms of recovery of function, strength, and general flexibility. So it is a good option. We know that the long-term results of partial knee replacements are very acceptable and are close to the outcome following full knee replacement, but it also has an advantage that there is greater flexibility, which is more like a natural knee function. And that's where a partial knee replacement operation scores well. If your condition is more widespread with a greater degree of arthritis within the joint, then total knee replacement is advised. And clearly in that situation, the choice of implant and the technique of surgery is critical to a good outcome.